How can I prevent another cryptogenic stroke recurrence? Imagine having a stroke with no clear cause and wondering what you can do to prevent it from happening again. That's what a cryptogenic stroke is, an ischemic stroke where doctors can't find a definite reason even after thorough testing. But don't worry, there are proven strategies to lower your risk of having another one. The main approach involves medications called antithrombotic therapies. Usually, doctors recommend antiplatelet drugs like aspirin because they help prevent blood clots from forming without causing too much bleeding risk. In most cases, aspirin alone is enough. Sometimes, for a short period of time, doctors might suggest combining to antiplatelet drugs for about 3 weeks, especially after minor strokes or high-risk transient ischemic attacks. Using blood thinners like warfarin or direct oral anticoagulants is generally not recommended unless a specific cause, like irregular heart rhythm, is found. Combining antiplatelets and anticoagulants is usually avoided because it increases bleeding risk. A key part of preventing another stroke is finding and managing hidden causes. Doctors often perform detailed tests to look for things like paroxysmal atrial fibrillation, a type of irregular heartbeat that can cause strokes. If this is found, blood thinners might be prescribed instead of antiplatelets. Sometimes, a small hole in the heart called a patent foramen ovale may be linked to strokes. If so, closing this hole through a minimally invasive procedure might help reduce future risk, but it does carry some risks like irregular heartbeats. If an infection or inflammation is suspected as the cause, treating that underlying issue is essential. Controlling your overall vascular health is also vital. This means managing high blood pressure, keeping blood sugar levels in check if you have diabetes, lowering bad cholesterol, maintaining a healthy weight, quitting smoking, limiting alcohol, and staying active. These steps help protect your blood vessels and reduce the chance of another stroke, no matter what caused the first one. Lifestyle choices matter too. Eating a heart-healthy diet like the Mediterranean diet, rich in fruits, vegetables, whole grains, and healthy fats, supports your vascular system. Managing stress and keeping up with regular medical checkups help ensure your prevention plan stays on track. Finally, ongoing monitoring is important. Sometimes, intermittent irregular heart rhythms like atrial fibrillation can be missed without continuous heart rhythm checks. Regular follow-up with stroke specialists ensures that any new risk factors are caught early and addressed appropriately. In summary, preventing a second cryptogenic stroke involves starting with antiplatelet medication, investigating for hidden causes, considering procedures like PFO closure if appropriate, controlling risk factors, and making healthy lifestyle changes. Always work closely with your healthcare team because each person's situation is unique. They can help tailor a plan that fits your specific needs and helps keep you safe.